Good morning, good afternoon, good evening, and welcome to a landmark episode number 50 of the Unboxing AI webinar series. Today, we have with us my very dear friend, almost like a brother, if I may say so, Angel. But before we get into Angel and his life journey and 100 other things, this is like I said, episode number 50 of the Unboxing AI webinar series. Every Thursday, 11 a.m. Eastern, literally no matter what, you will have to see my face and listen to me talk to someone who knows a lot more than me and try to unbox this whole mystery of AI. If you don't know what CARPL is, well, besides organizing a webinar every Thursday, we are an enterprise imaging AI platform helping you build, test, deploy, and monitor any kind of radiology AI in your workflows. Single user interface, single data channel, and single procurement channel for a lot of AI solutions that we have on our marketplace. And one of our favorite solutions is Qubiim. And that brings us to today's guest, Angel. Angel is, I will just read out his bio because otherwise I'll just end up saying something random. So Angel is, of course, CEO and co-founder of Qubiim, a global company specializing in designing and developing pioneering tools that combine advanced medical imaging analysis and AI to achieve precise diagnosis and suitable treatments. Uh, my own brother used to work for Ankel for almost 4 years, Kabir. So I've
Yeah.
been to their office, and that's why we have a very very special relationship. Their recent solutions have focused on cancer detection and prediction. He holds a degree in telecommunications and engineering from the Polytechnic University of Valencia and a PhD in biomedical engineering as well. With 15 years of experience in imaging and computer vision, he obviously possesses deep knowledge of the challenges and opportunities in the field. He's authored more than 100 articles, and if you know Ankel well, you know that he's generally found speaking at some conference all over the world. So thank you, Ankel. It's truly a pleasure, truly an honor to have you here for the 50th
Thank
episode.
you. Thank you for inviting me, Vidur. It feels so special, and even more, with this celebration of the 50 episodes they are doing right now. So it's great.
Thanks, Ankle. Ankle, so as is customary in these episodes, you have to take the arduous task of explaining what it is that you and your company do, as if you were telling a 5-year-old. I think you may have some practice of that, so.
Yes, three times practice. Exactly. So, well, basically, at Qubiim, we develop pioneering tools that aim to transform mainly tomographic imaging data. That means for a 5-year-old, imaging modalities that allow us to have slices from the human body, being it MRI, CT, or PET. These are our main modalities. And let's say that the main vision of the company is not only to develop these tools to detect or diagnose disease, but also ending up being a way of health assurance. So right now we are very much looking into our vision of how can we get information of our health status, about the health of our organs, how to use imaging not only where we feel sick, but before that, right? And that's kind of the vision of Qubiim, where we are trying to basically analyze what's happening inside our bodies. No, we've dedicated an immense amount of effort to see the universe, but maybe we have someone we love next to us, and we don't know what's going on inside, right? So that's what we are doing.
So interesting. So you are making tools to look inside the body.
Yes, exactly.
Fantastic. Awesome. No, thanks for that, Ankil. You know, and we were talking before the webinar, right, that you guys recently raised a $50 million Series A round.
Yeah.
So you should, like, definitely take classes for all of us other health tech entrepreneurs on how to do this. But what do you think? Like, it's a massive series A, right? And from our industry standpoint, it's even more special. Uh, what do you think this means for our industry? Like, uh, how is the investment community looking at radiology AI, or I don't even know what is the positioning, like, what does it mean for us?
Yeah, that's a great question. Overall, I've been quite critic with some ways of how companies in our industry are pitched, right? I do think that imaging has the potential to be elevated enormously, and the main intention of Qubiim has never been to end up being just a workflow improver for radiologists, right? If we pitch ourselves as I'm gonna optimize your work list, I'm gonna prioritize exams. Of course, that's great, but you will see that in the end, the value that you can bring to radiology might be limited to the radiological process. But if you basically start to look outside and you look at specialities like oncology, like neurology, immunology, where you can also put on those specialist shoes and think what they want from imaging. And if you ask them, most of them would really like kind of information that's similar to what they might find in a genomic panel, for example, right? That's
Mm,
kind of information telling them whether the patient might be at risk, whether the patient might have a low overall survival, or whether the patient will respond to an immunotherapy. So instead of developing tools just for the work list, I was thinking, okay, why don't we try to elevate the bar of imaging and be actionable for biopharma companies that are developing new drugs for the future, for oncologists that want to predict what's going to happen, right? Uh,
mm,
and
mm,
that's why we put that focus on transforming imaging data into actionable predictions. I don't want just to say that with Qubiim you will do less clicks. That's nice. That's nice. Okay, you can do less clicks. But when you go to the market, to the investment market, that's low value, right?
mm.
That's low value compared to having imaging enable a drug approval, for example, right?
Yeah.
And that's the essence, no?
Mm,
And I started to see that there were some proof points that we had. We've had stable collaborations with Merck, Bayer, with Novartis, with J&J, that were backing that idea that imaging can do more, right? And when you start putting that focus, it just tractions all the rest. Of course, we will improve workflow with QP prostate,
mm,
but our
mm,
goal is not just to detect lesions, is to predict outcomes, right, in the patients. And if you look at our investment round, it's been led by life science investors, right? People from the biopharma diagnostics space. And I think that's the essence of it in this case.
So, Akhil, would it be fair to say that it doesn't matter what core technology you are using uh, to build these tools? Like, so for example, let's say you build a tool to predict the response of prostate cancer to a certain drug, right? Uh, and let's say that tool doesn't use deep learning, right? It uses math, right? Or it uses physics, or like
Yeah.
traditional image processing. Do you think that matters less, like the backend technology matters less, and the use case, whether it's a productivity use case or it's like a, let's just call it transformational use case, that matters more?
Um, I
Or
wouldn't.
I'll ask the question in
Yeah,
a different way,
yeah,
Angel. I'll ask you, like, if I am, say, a 23-year-old bioengineer
yeah.
starting my company today, and my product does not use AI, right? It doesn't use deep learning, doesn't use reinforcement learning, none of that, but it is still a valuable product. Do I need to sprinkle some AI on it?
I mean, it's hard for me to imagine a tool that can right now look and link, future outcomes in patients with current imaging exams or data. That's not AI based at its core, right? So that's a great assumption, the one you make, but I can also see right now that everyone is so excited to incorporate AI in their practice, starting by biopharma companies, that the AI component is an important one, right? But it's all coming together, right? If right now, for example, we want to link, as we do, a CT scan done now with a response prediction to immunotherapy, the way we have to do it's a hard way, right? There are no shortcuts here. we need to
Yeah,
take we need to get that data. We need to have longitudinal data from patients, images from one time point, and then the follow-up of those patients in the next 5 years, right? This is hard to get. It's not so easy to get longitudinal data from patients. So that kind of vision, I mean, it's a kind of hard one. It's a hard endeavor, but we sometimes say in the company, embrace the heart, because in the end,
yeah,
if we have to develop something meaningful that really adds value, that makes a radiologist go to a tumor board and say,
yeah,
hey, I am the radiologist, and now, guys, I can predict what's going to happen with these patients thanks to my AI. Then, of course, you need high quality data for that. That's the way it has to be if we want to grow this market. You know.
yeah. No, that's very interesting. I was more alluding to, say, solutions that are like newer pulse sequences, right? Like for MR.
Yeah, yeah,
Those kind of things. Uh, that, but then again, you're also right in saying that if there is anything that can deliver X performance today, there has to be a way of improving that X by at least 10, 20, 30, whatever, some percentage number, using some kind of AI, simply because you are losing out on some signal that is not
yeah.
perceivable by
And,
human eyes or something like that.
and I was the one saying 5 years ago, AI is not the main goal, right? It's a tool. But in the end, you realize that every time you start, for example, in image quality harmonization, we made significant improvement by adding, AI to all harmonization, looking at the frequency domain, and it's outperforming all the traditional kind of image-based approaches, right? So that's why I think right now keeps being the way to go so far. Mhm.
Kips, what is that?
Of
Sorry.
being the way to go, no? Using
Ah,
AI to improve the
yeah,
different steps of the pipeline. Yeah.
yeah, yeah. Interesting. So, Angel, you know, you started off as a scientist, and now you're a CEO of a large company selling all over the world, etc. How does what was that journey like? Like when did the idea of becoming an entrepreneur come to you, and what was
Yeah.
that like first leap of faith like, and when was it?
Yeah, it was, took 10 years ago, right? I was not even imagining this would end up this way, right? I didn't know what was coming. So I was doing research, and basically I was seeing that it was quite difficult to transition to clinical application, everything we were researching on, right? We had algorithms, we had papers, but we had no single algorithm in the market. And I learned that the way was to basically build a company and doing it ourselves. And even at the beginning, the terms investment, VC, were kind of super far for me.
Yeah,
And I
yeah,
was kind of admiring people that was in that space, and I could not imagine I would end up being in this space, to be honest. But I was lucky. First of all, I want to recognize Luis Marti Bomati. He's been my co-founder. He's been a mentor, a co-founder, a friend. I've been so lucky, and I recommend everyone to have a great mentor in the very early days of your career. It's so important. Luis, I think, has impressed in me also a way of managing the company, even if he's not aware about that. In
yeah,
in the way he behaves, no? But at 30, that's when I started. I was so lucky again to find another mentor in Valencia area. That's one of the best businessmen in Spain, right? Who invests in Valencian companies and really wants to push for the region. He's the CEO and president of the biggest grocery chain in the country right now, and he dedicates dividends to push entrepreneurs from the region, right? So when we started, one of the things I learned that was so important to build a great corporate culture, right? I could see a difference in everything this guy built, and but I could see a common line in all the companies he was managing. That's a great corporate culture, right? So he was very intense on, write down the mission, the vision, make sure everyone at the company learns that all the behavior of the company as a human has to be based on the mission, the vision, and all these. So I started learning a lot about corporate culture. I really love that. So I started getting more into business, into knowledge, and I started to see that I love managing people, right? I consider that kind of nice discovery to myself, and then to manage interactions with investors as well, which I think it's so exciting that there are people that are deciding to invest in ideas and to help to develop them. That was also a total discovery again, because I was not coming from that VC space, no? So yeah, it's been a journey of adaptation. It's not, sometimes intelligence is not the QI. It's basically how you can adapt, right? And and I think this journey has been a one of adapting to the different situations that the company was putting to me, that these are in the end milestones to be overtaken.
So, and Ankel, if you were to like, you know, do the journey all over again, what would you do differently?
Oh, so many things, right? I think about that a lot. I think about basically my first 5 years were errors. I did a lot of mistakes, and and I learned about them. Of course, I learned a lot during those 5 years. But for example, how not to build a product, right? I was trying to build the first product too comprehensive, like a huge platform with a lot of apps, with a data environment for pharma companies. So it was like a mix of everything I had in my brain. I just had it in the product, right? And then I learned, okay, we need to be clearer on a product strategy. So we decided to split the product strategy afterwards. This is data. These are, patients, huge amounts of data. And this is another thing. These are medical devices applied for a single individual. So product design, I learned a lot, regulatory, again, landing in the US, who can help you to get the FDA clearance, which consultants you work with, building those relationships. It was, just a learning curve and a process. And what I would do different now as a second time founder, if ever comes in the future, I just grab the phone and I know who to call. No, so what I would do differently is working with the first contact with the network, and I did so many mistakes. No.
I think, and towards that end, there's a question as well, Ankle, that's come in. It says, at the time of your 510K clearance, QP Prostrate was the only tool on the market providing automated regional organ segmentation. How big a challenge was that? Um,
Um,
so, yes,
yeah,
basically, you were the only segmentation product. So to get the FDA, how challenging was it?
uh, it was challenging, but I would say it was less challenging than the recent clearance we've had as a CADI-CADEX to detect and diagnose lesions. That very first clearance, basically, we had to prove that we were segmenting the gland accurately. But in the end, it was a 510K that we label under the MIMPS, which means Medical Imaging Management and Processing System, which is different from a CAT, right? Basically, for everyone to understand, a CAT needs a clinical study, multi-case, multi-reader in the US. That's expensive. And MIMPS, not. You just need to prove kind of what you are developing is accurate as a standalone performance, right? And what we did there basically was to prove that we were segmenting the prostate gland accurately. But then this was also another discovery. When we were trying to sell that, we realized that radiologists were saying, and the lesions, where are the lesions? And we were like, okay, this is a scientific discovery. We need to work more on that. This needs more AI because it was a frontier of research, right? How you build a model that spots lesions that are
Right.
cancer in MRI. So that took us like 2-3 years more to build the algorithm trained with biopsies, right? And I could have gone all out trying to sell that kind of prostate gland MVP, even having FDA clearance, but I would have totally failed if I would have done that. So I decided to press pause, spend 2 years more developing, the algorithm to detect lesions, and then now clearance, and we can provide the whole MVP. But
So,
yeah,
and is this is a 510K as well, Ankel, or this is a de novo?
it's a 510K as a CAD CADEX, which means basically that we have done a multi-case, multi-reader study in the US,
Yeah.
led by Mass General Brigham, 330 patients, and then we have to prove what is the delta that the radiologists have thanks to our AI model, right? So we compare the radiologists without us versus
Yeah.
the radiologists with us, no? And so it's been a learning as well to run a large study in the US. Yeah.
And has that been published as yet?
We are publishing it now. The results are already published in the 510K summary.
Ah,
So
okay, they're there.
there
Nice.
are the results of the study. And right now we have all the kind of full 50, 60 pages report from MGB. And right now we are converting it into a paper, right? That's
Nice.
gonna be sent for publication in the coming 2 weeks. Yeah.
Oh, wow, nice. No, looking forward to it.
Yeah.
There's another question, Uncle, that's come in. This is from Lalit Sharan. They ask, coming from a scientific background, how did you handle the gap in understanding practical aspects of the workflow? Usually in a research or science, or usually in research science, the focus is on solving a technical problem, and other aspects are often neglected. How did you deal with that? So how do you know workflow as a
Yeah.
scientist?
I had that by default, I must say, because my day one work, after graduation was in a private hospital in Valencia. And there was no other space to put me but in the radiology reading rooms. So I was sitting next to the radiologist developing algorithms, right? And I remember they were telling me, "Are you playing arcade with those colors on the screen? What are you doing?" Right? So they were not even understanding what I was doing at that time. But then I learned all the problems and the struggle of the workflow, right? They had to move from the PACS screen to another place to do the post-processing, go back. Sometimes they were using a USB stick. So I learned a lot on how to not to do, the workflow. And right now, that's why I keep being so extreme in the company on the zero-click approach and the
Yeah,
seamless integration and all Dockerized, fully, modular, embedded,
yeah.
that kind of stuff. Yeah.
So I think it's uh, I say this to everyone as well. Like, just go and sit in a hospital, right? Just
Yeah.
or just
Yeah.
go and sit with the tech. Like, look at the problems and look at how it is, because the problem, but very honestly, Uncle, that I see is that, and this was very beautifully described to me by a radiologist in San Francisco once, that watching a radiologist do their work is like watching someone else read a book, right?
Yeah.
And it's the most boring thing you can do, right? Because the person who's reading the book is the one who is having the fun, and you're just looking at them. But yeah, but that boring stuff also leads to insights. so
Yeah.
so you
Yeah.
have to do it. So next question, Ankil, we have a bunch of questions. Next question is from Shruti, who runs marketing at CARPL. She asks, what has surprised you the most when it comes to enterprise AI adoption in radiology? Any lessons from customer resistance or unexpected kind of champions?
Well, it's a difficult one, okay? Because there are so many things that
Yeah.
surprise me. I would say that what has surprised me a lot is that um, you might think that when you show the results of a study, which is
Yeah.
positive, about an AI model to radiologists, to the end users, they will say,
Yeah.
"Oh, great, these results are awesome. I adopt the solution," right?
Yeah.
Until you don't reach a level where or a situation in which they can actually test in their own real life that your
Hmm.
algorithm is solving a problem they have in a
Yeah.
only one case, only one great case you solve for them can
Yeah.
be a flip on their mindset, right?
Yeah.
And we've converted like people that was against AI totally on purchasing the algorithm because we saved them in one case.
Yeah.
They were giving a case of negative, it was a false negative, and we were highlighting the lesion there that ended
Yeah.
up being biopsied and was positive, no? So you can show all the statistics of the world, but in the end, the doctors, when they test the tool with their own cases, they realize, oh, that now I understand the value of AI, right? That's what has surprised me the most because I thought, come to me with data, statistics, and then I make the purchase decision. It doesn't work that way always,
Yeah.
right? It's a lot of word of mouth. Is what is my colleague doing?
Yeah.
Show me a case where how it works, and it's more that kind of marketing.
No, interestingly, Ankil, I use what I typically tell people is uh, it's like interviewing someone, right? Like you may have the fanciest degrees in the world, but you still need to get interviewed and for the job, and then you actually have to do the job, right? If you can have all the degrees in the world, you can be like a top scorer in all the exams, but if you actually can't do the work that you're supposed to do, then you may get paid for a few months, but
All for
uh,
nothing.
same thing is with AI, right?
Yeah,
You can have all this metrics in the world, but if you don't actually deliver, then
yeah,
what's the point?
yeah.
Wow, questions after questions. So we'll just quickly run through these, Ankil. Anonymous attendee says, what's one thing about scaling radiology AI globally that the VC world doesn't fully appreciate yet? Interesting question.
This is very interesting. Um, I think VC world right now doesn't really appreciate the level of on-prem deployments that you find, right? Every
Yes, yes, I agree.
yeah,
Beautiful answer, Uncle. Like,
yeah,
I hope my team is listening and uh,
yeah. I mean, we
yeah.
have a huge amount of solutions which are still on-prem, right? And when you talk to VCs, sometimes they might think that deployments are easier than they really are in hospitals, and that's where I feel a gap in communication sometimes because they especially software-based VCs, you take a
Yeah.
software VC, they might think, okay, this is just rolling out the solution, multi-tenant from the cloud, done, right? And the barrier you have to overcome, you need to negotiate a cloud solution with a site, with a hospital. That's huge. Even right now in 2025, you need to convert a lot of people.
Oh yeah, no, I think that is a beautiful spot on answer, Ankil. On-prem is still very much the fastest way to get into a hospital. At least I believe that.
Yeah,
Last question from Mitch Goldberg from NTT. I'm sure you know Mitch.
yeah.
As a leader in the industry, do you have a view on the timing of multi-factor AI, which is like labs plus detection plus genetics,
Yeah.
and perhaps aggregating what Qubiim does today with Gen AI, agentic AI tools, etc. So what does the future hold?
Well, I think it's going very, very fast, right? Right now, there are companies out there. At Qubiim, we are not really willing to be a multi-omics company, right? We just want to be a great radiology company, AI and radiology company. That's our expertise, right? But I can see companies like Tempus leading the way on basically all the multi-omics approach, willing to right now grow in the area of imaging as well with the Pixel department. Also, other many companies, IQVIA trying to go into imaging. So as we access more and more and more like multimodal data and generative AI will be trained with imaging, genomic, clinical data sets. I'm sure in the next 5 years, we will have kind of ready for clearance AI models that are kind of multifactor for sure. Yeah.
Oh, wonderful. Amazing. With that, we can wrap up. Thank you everyone for joining. Thank you, Ankel. This was amazing. And yeah, we'll see you here next time. Same time
Yeah.
next week.
Yeah.
See you.
Thank
Thank you,
you.
Ankel. Thank you so
Thank
much.
you, everyone. Thank you all the
Thank
attendees.
you.
Okay.
Thank you.